A single bite from this insect can permanently rewire a person's immune system against red meat, turning a cheeseburger eaten months later into a medical emergency, hives spreading across the body, throat tightening, blood pressure dropping, all triggered not by anything dangerous in the food itself, but by an allergy created entirely by an insect, bite the victim may not even remember. This isn't a rare medical curiosity buried in an obscure journal. It's a documented, growing phenomenon across a widening portion of the United States, and the tick responsible for it is one of the most aggressive, most easily encountered ticks in the country. This is the Lone Star tick, named for the single silvery white spot found on the back of adult females, common throughout the southeastern and south-central United States, with a range that has been documented expanding northward and into the Midwest in recent years. Unlike some ticks that wait passively for a host to brush past, Lone Star ticks are unusually active and will actively move toward a person or animal across open ground, making encounters in tall grass, wooded edges, and even some backyards considerably more frequent than with more passive tick species. What makes the Lone Star tick dangerous starts with something almost unbelievable in its specificity. A sugar molecule found in its saliva called alpha-gal, a carbohydrate structure that happens to closely resemble a sugar molecule naturally present in the tissue of most mammals, other than humans, and a small number of other primates, meaning it's found abundantly in beef, pork, and lamb. When this tick bites a person, alpha-gal from its saliva enters the bloodstream, and in some people, the immune system responds by producing specific antibodies against it, essentially training the body to recognize this sugar molecule as a threat. The problem is that the immune system doesn't stop recognizing it as a threat once the tick bite heals. It remains primed indefinitely, ready to react the next time that same sugar molecule enters the body, which now happens every time that person eats red meat from a mammal, since the same alpha-gal molecule the immune system was trained against is naturally present in that meat's tissue. This condition is called alpha-gal syndrome, and it represents something genuinely unusual in the world of allergies. A real, lasting food allergy created not by repeated exposure to the food itself, but by a single insect bite. Beyond this distinctive allergy, the Lone Star tick is also a documented vector for several other illnesses, including ehrlichiosis, a bacterial infection affecting white blood cells, and southern tick-associated rash illness, a condition causing a Lyme disease-like rash, though caused by a different organism, underscoring that this tick's saliva carries genuine biological risk on multiple fronts beyond the allergy alone. None of this evolved with humans as any kind of target. The alpha-gal molecule's presence in tick saliva likely relates to the tick's own feeding biology on the mammals it normally encounters in the wild, and the bacteria it can carry are simply organisms that have adapted, like so many other tick-borne pathogens, to exploit the tick purely as transportation between hosts, with human alpha-gal sensitization existing as an unintended biological side effect. Of an immune system encountering an unfamiliar molecule it was never built to recognize before. The bite itself often produces only mild, localized symptoms at first, some redness, minor itching, sometimes barely noticeable, especially given how readily this tick attaches and how quickly it can begin feeding once it reaches skin. For most people, this is where the story ends. A forgettable bite indistinguishable from countless others throughout a lifetime spent outdoors. But for those who develop a sensitization to alpha-gal, the real horror unfolds later. Often weeks or months after the bite has completely healed and been forgotten, the connection between insect and illness severed entirely in the victim's mind. The reaction typically begins 2 to 6 hours after eating red meat, a delay dramatically longer than most food allergies, which usually announce themselves within minutes. This delayed onset is part of what makes alpha-gal syndrome so disorienting and difficult to diagnose, since the timing makes it nearly impossible to immediately connect symptoms back to a meal eaten hours earlier. When the reaction begins, hives often appear first, red, intensely itchy welts spreading across the torso, arms, or back, sometimes starting small and expanding rapidly across larger areas of skin within minutes of first appearing. Abdominal pain and nausea frequently follow, sometimes progressing to vomiting or diarrhea as the digestive system reacts to the allergic response unfolding internally. In more severe documented cases, the reaction escalates into full anaphylaxis, the throat or tongue beginning to swell, breathing becoming increasingly labored as airways narrow, and blood pressure dropping as blood vessels throughout the body dilate suddenly, leading to dizziness, lightheadedness, and in the most extreme presentations, loss of consciousness if the reaction isn't treated immediately. What makes this particularly unsettling for those affected is the betrayal of something completely ordinary. A meal that's been eaten safely 1,000 times before suddenly becomes dangerous, with no warning beyond the reaction itself, often leaving newly diagnosed patients confused and frightened during their first severe episode, since nothing about the food or the eating experience gave any indication something had changed. Picture someone living in rural Missouri who spent a summer afternoon clearing brush at the edge of their property, brushing off what felt like an ordinary, forgettable tick bite on the back of their leg without much thought. Months later, after a routine dinner featuring pork chops, they begin breaking out in hives within a few hours, followed by stomach cramping severe enough to send them to an emergency room, where doctors, increasingly aware of this condition in tick-endemic regions, run blood work that finally reveals significantly elevated alpha-gal antibodies, connecting a months-old tick bite to a sudden, life-altering food allergy no one saw coming. Diagnosis typically involves a specific blood test measuring alpha-gal antibody levels, and management centers on strict avoidance of red meat and, in many cases, other mammal-derived products, since the same sugar molecule can appear in less obvious sources as well. Anyone experiencing delayed hives, stomach pain, or breathing difficulty several hours after eating red meat, particularly with a history of tick bites, should seek allergy testing. Severe reactions require the same emergency response as any anaphylaxis. Epinephrine, if available, followed immediately by emergency medical care. There's one more detail about this tick that explains why doctors across the country have had to fundamentally rethink what an unexplained allergic reaction might actually mean. Here's the detail that continues to surprise even some physicians. Alpha-gal syndrome was barely recognized as a medical condition before researchers connected the dots between tick bites and a rising number of unexplained, delayed allergic reactions to red meat, a connection only firmly established within recent decades. Since then, documented cases have expanded well beyond the Lone Star tick's traditional southeastern range, tracking the tick's own expanding territory as warming regional climates and shifting wildlife patterns have allowed it to establish itself farther north and west than historical records ever showed. For an immune condition with no cure, only avoidance, the Lone Star tick has effectively created a permanently expanding population of people who must now treat an everyday American dinner staple as a genuine health threat. The Lone Star tick doesn't need a venom gland or a deadly pathogen to leave a lasting mark on a human life. It only needs a single molecule, hidden in its saliva, capable of quietly convincing the immune system to turn against something as ordinary as dinner. And somewhere out there, another creature is waiting with its own strange, almost unbelievable method of disrupting the human body in ways most people would never expect. What you just learned took years of research to uncover, but it can take you 10 seconds to make sure you never miss the next one. Subscribe now, because the next thing hiding in plain sight might be more dangerous than this one, and you deserve to know before it finds you. There's another one just like this waiting for you. Tap the video on screen now and see for yourself.